We often hear about our bodies as these perfectly designed machines. But today, we're not going to talk about the perfect design. We're going to talk about the glitches. We're diving into the strange, fascinating, and sometimes surprising ways our internal plumbing can go seriously wrong. Okay, get this. 60,000 miles. That is enough vascular roadway to circle the entire planet more than twice. I mean, with that level of complexity, you're just bound to get some glitches in the code, right? So what happens when this incredibly intricate system starts to break down? Really, the best way to think about our vascular system is like a massive, critical piece of infrastructure. You've got superhighways, you've got local roads, and you've got tiny little side streets. But just like any city's infrastructure, it can have design flaws, epic traffic jams, and totally unexpected breakdowns. So let's start with those traffic jams, and I mean not literally. These are conditions where one part of the body is physically pressing on or even crushing a major blood vessel, and that can cause a whole cascade of problems downstream. A classic and kind of perfectly named example is Nutcracker syndrome. Just imagine your aorta and another big artery, the SMA, acting like the two arms of a nutcracker, and the poor victim getting squeezed in between, the vein coming from your left kidney. Now, what's really interesting is that a lot of people have this exact anatomy and are totally fine. It only officially becomes a syndrome when it starts causing painful symptoms. And here's where it gets really fascinating. The exact same anatomical problem shows up in completely different ways depending on your sex. In men, all that pressure backs up into the left gonadal vein, causing testicular pain, which, is how the syndrome got its very memorable name. But in women, it can cause pain in the lower left part of the abdomen, and believe it or not, it's actually more common in healthy women in their 30s and 40s. Okay, another major issue is something called renal artery stenosis, or RAS. Stenosis is just the medical word for narrowing. So in this case, it's not a vein being squeezed from the outside. Nope. This time, the artery to the kidney itself is getting narrower on the inside. And that can have some really serious consequences, especially for your blood pressure. So what's causing this narrowing? Well, in about 75% of cases, the culprit is atherosclerosis. Yep, the same hardening of the arteries that causes heart attacks. But what about that other 25%? Well, that's where we find problems that are less about wear and tear and a lot more about faulty blueprints. So let's take a look at that other 25%. These are the problems that aren't caused by compression or lifestyle, but by actual flaws that were baked into the body's original design blueprints. This brings us right to fibromuscular dysplasia, or FMD. This is the main reason for that other 25% of renal artery stenosis. The key things to know here are that 1, it's not caused by plaque buildup, and 2, it mostly affects the arteries of younger women. But the most crucial part is that it has a very, very distinct look on an angiogram, which is basically an X-ray of your blood vessels. And this is that classic visual clue doctors are looking for, the string of beads. It's so descriptive. On that X-ray, the artery literally looks like beads on a string because of these alternating rings of narrowing and bulging. It's a perfect example of how a single, unique visual pattern can point straight to a specific diagnosis. All right, now for a really complex blueprint flaw, Osler-Weber-Rendu syndrome. This is a genetic disorder where the body just creates multiple arteriovenous malformations, or AVMs. The best way to think about it is like this. Normally, your high-pressure arteries feed into a huge network of tiny capillaries before flowing into low-pressure veins. An AVM is a direct, high-pressure short circuit between an artery and a vein. And with this syndrome, these short circuits can just form all over the body. So if a doctor suspects this, what's the game plan? It's a pretty clear 3-step process. First, the suspicion usually comes from the patient's history, like getting a ton of nosebleeds. Second, they'll scan the lungs and the liver, which are super common spots for these AVMs to hide. And finally, and this is absolutely critical, they screen the brain. Why? Because the biggest risk for these patients by far is having a stroke that's caused by a brain AVM. Our next category of glitches, well, it's a little different. It's not really about compression, and it's not a faulty blueprint. These are breakdowns where the cause is pretty mysterious, and the process itself is just highly destructive. Let me introduce you to segmental arterial medialysis, or SAM. The name sounds really intimidating, but it tells you exactly what it is. Medialysis means the breakdown of the media, which is the middle muscular layer of an artery. And for reasons that we don't totally understand, this layer just, it falls apart. Now, this condition typically targets what doctors call the splanchnic arteries. It sounds really complex, but it's just a term for the major arteries that supply blood to your gut, so your stomach, your intestines, and all your other digestive organs. So, how did doctors even recognize SAM? It has some key hallmarks. It hits different targets based on age. It's the gut arteries in the elderly and the coronary arteries of the heart in young adults. It leads to a whole mess of problems like multiple aneurysms, those weak bulging spots, and dissections, which are actual tears in the artery wall. And really importantly, it isn't caused by inflammation, which sets it apart from a lot of other diseases. The biggest danger here, sudden, massive internal bleeding. Okay, now let's put this knowledge into practice. We're going to see how a seemingly common and, maybe benign physical finding can actually be a critical red flag for one of these really serious underlying vascular problems. Let's talk about the testicular varicocele. It is essentially a varicose vein of the testicle. And what's just fascinating is this statistic. 98% of them happen on the left side. And this isn't random at all. It's because the left vein has a longer, more awkward path to drain its blood, which makes it much more prone to getting backed up. And this is where a doctor's diagnostic logic really shines. An isolated left-sided varicocele is usually not a big deal. But if one shows up on the right side, or if it doesn't decompress, meaning it doesn't go away when the patient lies down, that is a huge red flag. The very next step is an immediate scan of the abdomen to look for a blockage or maybe even a tumor. This is the critical takeaway. Specifically, in a man over 40, a brand new varicocele that doesn't go away when he lies down should immediately raise suspicion of something much more sinister, like a kidney cancer that has actually grown into the renal vein and is causing that blockage. So the crucial point here is this. The body often leaves clues for us. What might seem like a really minor, common issue on the surface can actually be a critical warning sign for something much, much more serious that's hidden deep within the body's complex plumbing. We've looked at traffic jams, faulty blueprints, and these mysterious breakdowns. But honestly, these are just a handful of the glitches in our biological code. It really makes you wonder, doesn't it? What other secrets is our body hiding from us, right there in plain sight?